number to deliver care for or monitor the health of more people, including those who might not otherwise receive quality care. One example here in your backyard and demonstrating in the hub that is next to us is the Apollo Telemedicine Networking Foundation, the not-for-profit organization part of Apollo Health Hospitals Group. Today, Apollo has emerged as India's single largest telemedicine provider, with over 125 centers, including 10 overseas. They've provided, as I learned this morning, 74,000 teleconsultations from as far away as 7,500 kilometers. And when you start to think about the availability of cameras on tablet computers and smartphones, you can expect to see telemedicine begin to break the tether of large networks and physical structures. We're already starting to see this in markets like the United States. It's a trend that holds great promise for extending the reach of providers. An emerging element of telehealth is the use of technology to monitor patients from a distance, which makes urban expertise available in rural areas and, again, addresses growing provider shortages. These technologies let one or two specialists monitor a large number of patients. In India, a partnership between Fortis and GE provides care to critically ill patients in small towns through an electronic remote monitoring program called CritiNext. The first electronic intensive care unit, or EICU, in Asia lets intensivists in Delhi monitor patients and help local providers deliver the best care. Another example from an Allscripts client, First Choice Home Health and Hospice in Utah, close to where Mark is one of the largest post-acute care providers in Utah. They have deployed remote vitals monitors into patient homes. Now a single telehealth nurse tracks 60 patients and lets First Choice spot trouble signs, reducing unnecessary and costly hospitalizations. So those are two examples of telehealth's ability to empower providers to take care of more patients in a highly cost-effective manner while addressing some of the disparities in care between regions. Looking ahead, remote patient monitoring will get even more interesting. Givun Imaging of Israel has received approval in the United States to market a micro camera inside a pill. Once swallowed, the pill photographs a patient's digestive tract, monitors photos wirelessly to the physician's electronic health record, and it's intended to replace a number of expensive and uncomfortable diagnostic treatment methods for gastrointestinal and digestive diseases. The second trend could be the most powerful and is certainly the fastest moving of all: mobile health, as noted by Secretary Ramasamy. Here we move from technologies that empower or expand the capabilities of providers to technologies that empower and engage patients in their own care. One example is My Care Team, a software platform that's integrated with electronic health records like Allscripts. Patients can transmit their blood glucose readings from their glucometers into an electronic health record, as well as track their progress on diet and exercise. Caregivers can now easily monitor a patient's progress against a treatment plan, and patients feel more engaged in their own health. Mobile health is also effective in addressing some of the very severe health disparities in Africa and other underdeveloped nations of the world. Ghana-based M-Pedigree is a solution that addresses the widespread problem of counterfeit medicines, which kill over 1 million people a year. M-Pedigree works with pharma companies and telecom providers to help people across Africa, the Philippines, and India identify the authenticity of medicine using free text messaging services. A third trend is the use of social media to leverage the network effect of billions of people who are now using these technologies. This again has the potential to engage patients in their own health, as well as revolutionize epidemiology. In the past, when there was a disease outbreak, epidemiologists would swoop in, armed with diagnostic kits, and spend weeks interviewing victims and gathering data, mostly in secret. New technology is democratizing the disease hunting process while helping patients protect themselves from outbreaks. Kazemil does this by monitoring Twitter for mentions of any 6 cold and flu symptoms. The software then presents the tweets in a form of interactive map. It was developed for a software company, a pharmaceutical company, SSP in Japan. You're looking at a data visualization of Tokyo, where each of the colored diamonds is a tweet of cold or flu symptoms. HealthMap.org is another example of monitoring social media to deliver real-time intelligence on a broad range of emerging infectious diseases for a diverse audience, including local health departments, governments, clinicians, and international travelers. These innovations hold great promise for empowering patients to avoid infectious disease while also accelerating the ability of governments and international bodies to respond to outbreaks. Of course, not all of healthcare's problems can be resolved by empowering patients. Trend 4, or what I call information clarity, addresses a systemic problem within complex health systems and communities, especially those more affluent. With affluence comes more care. With more care comes more information. But the problem is that that information is not available in one place or ways that's commonly understood. To coordinate care for patients who see multiple providers, often in entirely different organizations, we need to move information between distinct IT systems from different by providers. That is a huge challenge. A good example of where we have a start is at Orlando Health, one of Florida's most comprehensive health systems. Orlando Health has 2,000 beds spread over 6 hospitals, 350 employed physicians, and thousands of independent physicians who refer patients to their hospitals. Using the Allscripts community record, Orlando Health can securely exchange information between clinical systems from multiple vendors. The solution aggregates and normalizes the data and presents it in the appropriate place and time within the caregiver's workflow. Today, Orlando's clinicians can receive radiology orders, lab results, demographics, and other information from these disparate systems and view all the information in one place within their Allscripts electronic health record. We call that a single view of the patient. And when you have a single view of the patient, you can get to a storyboard. Part of our next generation user configurable physician dashboard, this patient storyboard displays a chart of patient's visit history spread across timeline and color-coded by visit type and location. So no matter where the patient sought care, clinicians can easily view and drill down into clinical history to get a complete picture of patient health. The final trend that I want to discuss is real-time analytics, enabled by advances such as pervasive computing described by Professor Raghavan. It's pretty clear that electronic health records will become more prevalent across the globe. With all that information, now comes a need for understanding what to do with it and how it can help improve care. Clinical analytics is part of the solution. Today, it's mostly a tool for spotting trends in patient care after the fact. But while that retrospective analysis is important, real-time analytics, and soon predictive analytics, has the potential to truly transform, as Sagita mentioned, the care process. One example is occurring at University of Kentucky, where they're using Sunrise clinical analytics from Allscripts in their 3 hospitals to develop an early warning system. The system monitors patients in real time for any signs of clinical deterioration based on metrics which the organization has set. The solution is triggered each time a patient's vital signs are entered into their acute care electronic health record. It calculates a patient's health score based on key vital signs and mental status and determines if there's signs of deteriorating health. It automatically pages a response team. As a result, the process of spotting and responding to patients who are in danger no longer takes up to 10 hours. It can happen nearly immediately. That is the cutting edge of analytics, moving from simply adopting technology to making information actionable now. It's what I expect will become commonplace in more advanced hospitals across the globe. And as the trends towards telehealth and mobile health accelerate, we will eventually see all this information moving outside the hospital as well. So those are 5 trends in healthcare IT that I believe will have the greatest impact on global health and have the potential to significantly address the challenges I outlined at the beginning of my talk. Fueling those trends are strong policies for investment in healthcare in many developing nations. Healthcare investment, both public and private, and through public-private partnerships is on the rise. Here in India, the government increased health spending by 25% in its 2012-2013 budget. And according to a Frost & Sullivan report, Indonesia and Vietnam have drastically increased their healthcare spending and aim to modernize their healthcare infrastructure. We've seen the same in China. We've seen the same in the United States, with large billions of dollars being spent on healthcare information technology. Rising wealth, greater demand for quality, and an increasing number of hospitals are factors supporting the growth of the healthcare industry in emerging markets. As I noted earlier, this is a double-edged sword. The United States is a model of a nation that spends so much on healthcare, nearly $3 trillion a year, that it has become an economic burden, crowding out investment in other important priorities. On the other hand, the need to control costs has accelerated the development of solutions by the healthcare information technology industry to help deliver more efficient and effective care. So overall, the trend of greater investment in healthcare bodes well for global health. So as we have seen, global healthcare is undergoing what may be the most significant transformation in history, thanks to the increasing availability of new technologies that empower patients and providers with effective and efficient tools.